Hello and welcome to the EduTalk series hosted by Biotone EduPartner Program, and massage industry experts. With the challenges that have faced massage schools, students, and practicing therapists over the last, how many years now? The EduTalk series by Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Tonight's expert is Diana Thompson, a practicing therapist with over 35 years experience. She's founder and owner of Hands Heal electronic health record systems. Additionally, she's a research consultant, educator, past president of the Massage Therapy Foundation, recipient of numerous industry awards, and author of Hands Heal, Communication, Documentation, and Insurance Billing for Manual Therapists, as well as author of Integrative Pain Management, Massage, Movement, and Mindfulness based practices. In fact, her Hands Heal book has been recorded and can be listened to in the EduTalk author series on Biotone website under the EduTalk tab. Again, thank you for joining us tonight. Let's listen and learn as Diana stresses the importance of good client charting and record keeping. We became MTs for a reason, and charting wasn't one of them. She'll explain how to keep clients coming back, satisfy legal requirements, save time and money, all with electronic charting. Diana will review basic charting guidelines, applying outcomes reporting, the new OpenNotes rule, and lastly, how to involve clients in charting and what to look for when you're searching for electronic health records. Thank you so much, Diana, for joining us tonight. And I know this will be a lot of important information, so I will turn it over to you. Thank you.
Great. And thank you so much. I just want to say thank you to you and Jean, and really want you to know. I really want you to know how much I appreciate all you've done for the profession. I think this is an amazing service that you're providing people through the pandemic, I'm sure, and beyond, this ability to get free education online. And I also really appreciate all the donations that you've made over the many, many years with the Massage Therapy Foundation. You've been huge supporters of this profession, and I think you give more back than most companies that are earning their complete living on the massage therapy profession. So I love you and I appreciate you. So thank you. And I am going to share my screen. I've got some PowerPoint slides to share with you, and let's just start the slideshow. So welcome and thanks. So some of the things we're going to talk about today, as Donnell said, we're going to look at the legal requirements and practice standards for charting in the profession. Not our favorite subject, but definitely something that's required of us. If your state considers you healthcare providers, then absolutely we have some pretty huge expectations on us about charting And just to make sure we cover the basic skills for charting, I think it's always good to go through and review what we should be putting in our charts. And outcome measures have become the most important part about charting. And there's some beautiful things that can happen electronically based on outcome measures. So I really want to talk about what kind of measures are available to us within our scope of practice and how to track these outcomes and how to take advantage of them to promote our practices and get some clients in the door and keep our clients coming back. It's a great way to motivate clients to make sure that they know in this time where money has been less abundant for people who weren't able to work during the pandemic, and they might need some motivation, also motivation to participate in their healthcare and get better faster and have more success with their care. And throughout this program, I'm going to highlight the benefits that having charting be electronic can provide for us. So that's what we'll be talking about today. I just wanted to reiterate both the differences between the state and national, but also letting you know why there are the laws and rules that there are. So there is a difference between laws and rules. Laws are the mandatory things. Rules interpret the existing laws, and they really help you understand the ins and outs of how to make laws, make sure that you're fulfilling the laws that are required of you. The boards that are set up, Board of Massage, in terms of your legal entity for healthcare. I know in Washington State, the Board of Massage is under the division or the Department of Health. In Olympia, in our state capital, and that's who writes the rules that interpret the law. But their primary purpose, the primary reason they have a Board of Massage is to protect the public. So it's not about protecting you. Our associations do that, but the legal entities that are set up to protect the public. So that's why we have the laws that we do. Nationally, we're bound by HIPAA, which is your, I'll tell you later what that stands for because I never quite remember correctly. I always think it's one thing and then it's something else, but hold on. That, and then the OpenNotes rule, which is a brand new rule, just went into effect April last year. They've been working on it since 2009, but it is now full-blown in effect, and we are required to abide by that. Then there's association standards like your practice standards. I know AMTA has those and ABMP has those. So whatever association you belong to likely has practice standards for you that are set up and ethical standards. And there are standards for healthcare. All of those things substantiate your need to record your treatment sessions for every single session you do. And it's not just when you're doing insurance billing that you have to chart. It's absolutely every single session. So you would never go to the doctor's office and it might be your annual check-in and everything looks great. They wouldn't say, well, you know, that was a wellness outcome. I guess we don't have to chart that. they would always, always, always chart the outcomes of all the tests, even though they're all negative. As a result, most states don't have written charting laws for any of the healthcare providers because they're required through your healthcare. It's an expectation. It's dictated by your associations as a practice standard. It certainly is a standard for healthcare. So don't think just because your state doesn't specify what you have to chart and how, that you don't have to chart, because absolutely in any situation, if you're thought of as healthcare, you're required to chart the sessions, every single one. Even if it's an on-site massage for a sporting event, you're required to chart that. So just want to make sure that that's perfectly clear as we start out in this, because I think, a lot of people think, well, I don't bill insurance, so I don't really need to chart. But there are some really clear guidelines about the differences between charting. Let's see, let me go the other way. There we go. Charting wellness and treatment, and we'll cover that today. So HIPAA is protects your health information. So personal health information includes your name and anything else that might be related to healthcare. The fact that you're going to a massage appointment. So that then takes scheduling software, if you're using scheduling software, and makes you required to be compliant with HIPAA standards. So HIPAA is about health insurance portability. I always think it's health information, but it's health insurance portability and accessibility. What does that mean? So it's the ability for people to know what's happening, different healthcare providers. Your client has a right to know what is insurance or what, medical information has come up in a session. Every client needs to have access to every single healthcare provider's notes that they see. So portability is about one insurance provider and another insurance provider sharing information. Accessibility is about the client having access to their insurance. So 3 rules of HIPAA. Sorry, I got a little flustered there. I got to slow down. 3 rules of HIPAA: privacy, security, and breach notification. So you are required to keep all the personal health information private and secure. So you don't talk about it with anyone else, and you keep things under lock and key or under password. Breach notification is should anything get away, get downloaded from a hacker, or if a cabinet is left unlocked and somebody gets into there and sees information that they shouldn't see, anything like that, any type of breach must include a notification immediately. There's huge fines when notification is not made fast enough. So anytime you're aware of a breach happening, you have to let people know immediately. So what's included with our requirement to be HIPAA compliant? If we are doing anything electronically, Facebook, scheduling, texting, emails, anything that could get hacked, or easily stolen away from your device, it has to be HIPAA protected. So what is included is the consent to treat and share. That's part of the 3 rules of HIPAA as well. And this is the website for finding HIPAA rules that will help you a great deal. So all this to say, if you share any information at all that includes the patient's name and the type of healthcare they're getting, or the time and day of an appointment and where it is, anything like that, it has to be HIPAA protected. If you're asking for filling appointments on Facebook and somebody says, I'll take one of those appointments, then you have to be HIPAA protected, and Facebook is definitely not HIPAA protected. Your scheduling system, it would be good to know if that is also HIPAA protected. Certainly your electronic health records need to be HIPAA protected. So make sure that your devices are password protected. That's a great way to start. And make sure that any place that you're communicating with your patients or clients has some sort of encryption or protection, or excludes anyone who's not given access to it. Keep swiping the wrong way. So the OpenNotes rule, this is what has solidified the idea that clients should have access to their chart notes. And they started working on this over a decade ago. They did a soft authorization about 3 years ago. Things weren't quite ready to go into effect right away. I think there weren't enough hospitals and clinics prepared, but you may have noticed now more and more that your doctors are sending you links to sign up for communicating with them, having access to your test results, for example, making appointments online, those kinds of things. They don't include their chart notes in there, but as soon as you ask for them, they then have to give you electronic access to their session notes as well. So look for an electronic health record that allows access to patients, to the massage therapist or your chart notes. It's something that I have taken very seriously and did from the start way back in 2016 when I first created Hands Heal electronic health records. I knew this was in the works. It's kind of part of my volunteer work with government relations, and just being in the know on that level of our profession. So by knowing that this was coming into place, I created patient portals where they can go in and fill out their intake forms and do pre and post charting or graphing of their pain, activities, and mood. And then they can also see all of their notes. So something to look for as you're looking at different systems. Let's go into basic charting skills. So wellness charting is very simple and is very, very fast. You should have a system that allows you to chart quickly and easily for wellness care, and then more detailed for treatment care. It's really important to have 2 types of charting in your system so that you can really fulfill the needs required given the situation or the client presentation. It's nice to have something that really is customized to the type of care that you're providing. There are systems out there that are fast and easy, and you can just do part of it versus all of it. It's also really nice just to have that differentiated for you. So you go in, you know exactly what you have to write down to be safe and skillful, and demonstrate that should anything be necessary in terms of any sort of malpractice that might happen, or any sort of litigation that might go on. Rare, but always something that we want to make sure as we're new in healthcare that's taken care of. So wellness charting, your intake is for safety purposes. You just need enough information to know that you're being safe and skillful with your care. Contraindications, that kind of thing, get them identified right away, but not a lot of details about illnesses and that kind of thing, because you're really just there to help someone relax and feel good, and not trying to treat a condition. So you basically do what you did, where you did it, and for how long. So was it an hour session? They were prone and supine. You did the full body, and you used general relaxation massage techniques. For treatment planning, you might have learned soap charting. I certainly taught soap charting for many, many years. All of my books are based in using a soap format. Soap in electronic health records is not really necessary. There are so many opportunities to just identify categories of information. You want to make sure you cover those 4 bases, of course. So looking for a system that asks for details, but those details really cover the full scope of a soap chart. Soap charting was something that came about in the 1960s, and was very much focused on problem-oriented medical records. So you could see that soap charting is absolutely not necessary for wellness care. You need to chart what you did and where you did it and for how long, but you don't need all the extra assessments, findings, outcome measures, those kinds of things that you clearly need in a treatment-oriented session. So every single session, you need updates on that intake. So the intake is for treatment planning purposes. You're going to get a lot more information about activities that worsen the symptoms. You know, what are the current presenting symptoms? What makes it worse? What makes it better? What are the findings as you palpate? What do you see? How do they move? And then any other types of assessments you might do, strength testing, those kinds of things. So you want to make sure you're really covering your bases in figuring out how they present themselves and talk about themselves, what you find, what you see, what you feel, and then what you do as well. You want to measure those findings in such a way that you can demonstrate that progress happened as a result of the session. So those outcome measures become very important. You also want to create a treatment plan for the future, and you want to identify ways that the client can help participate in between sessions. So your treatment goals, what are you focusing on from a functional standpoint, an activity standpoint, as well as from a treatment standpoint? That's how you create your treatment plans. And then projecting what you might want to be doing into the future and how the clients can participate in that. So by measurement outcomes or outcomes measures, it's all about the progress. And the types of measures that we commonly take are focused around pain. Pain is a great outcome measure because it's easy and it's fast and people can talk about how they're feeling. You can touch someone like in a trigger point to stimulate a response and get a measure for that. Unfortunately, pain by itself is not very expressive of progress. People have a threshold of pain and they'll oftentimes hit up against that threshold of pain. So you can see how by the time the person comes in to see you, they've already reached their threshold. They're going to do everything that they can possibly do until they hit their own threshold of pain. So if they keep coming in and every time they come in and see you, they're at a 5 out of 10 in pain or something, then that's what you're going to continuously see session after session. If you're not measuring post-session, you have a problem. And if you're not looking at activities, you have a problem. So the other thing, the third thing that we're encouraged to look at is mood. The Veterans Administration doctors got together and came up with a measurement tool that really covers all their bases. And it combines pain, activity, and mood, none of which are diagnostic in and of themselves, hence the word mood instead of anxiety or depression, those kinds of more diagnostic terms. But mood is a very safe thing to talk about. And it's easy to refer to the pain when you talk about the mood. So how is your condition? How is this pain? How is this functional limitation or this inability to perform your daily activities affecting your mood in daily life? You know, the fact that somebody can't pick up their child because of their low back pain is terribly disruptive in their life if they have a small child that they dearly love and the child wants to be held. So getting that kind of information is very helpful. Also, coming from a research background, one thing that I've seen over the years is there's way more data about massage influencing mood than pain. Way more data. So it's important for us to start to include that in our conversations with our clients. So we have this sense of of things we want to identify or measure over time. We can measure them numerically. So 0 to 10 is the most common scale to use in research and across professions. You also may have seen the faces, the smiley faces and the crying face. That's another great visual way to identify pain or frustration, mood. There's the value scale, which is more like light, moderate, severe, or normal, good, fair, poor. Those can be used. Or this dot on a line where you can move dot around. I clipped this from my EHR. I haven't seen a lot of this used in the electronic health records. What I like to use and look for in other charting systems is something that a, a, a client can easily work with, easily identify, something even that can be collected before the session. Clients can log in, fill this out the day before, the morning before they come in, and then you've got this information to review and use to help plan your session before they even walk in the door. And I think that's very helpful for me as a working massage therapist, so that we start the interview already into the conversation. And it saves a lot of time and gets people on the table faster. And you don't feel guilty about having charting interfere with your session, and clients feel good about time well spent. You can also identify where the pain is and then get more specific with it, what the activity is, and how it relates to their daily life. There is no drop-down menu for the mood scale, as you see it in the corner, if you can see it. And then they can give more details as well. And then there's an identical post session information afterwards, so that clients the next day can log in and let you know how they're feeling just past the session. It's great. You're also going to look at movement measures. How are they walking in the room? How are they doing their range of motion testing? How easily are they sitting down and getting out of their chair or getting up and down off the table? Visual types of things that you'll want to record are like postural assessments over the if those grid charts. I don't know if you've ever seen David Kent's grid charts. Those are really handy. I think I have an image of those right here. So this is off of David Kent's website with his permission, but I have one right outside my treatment room. I don't put people in their underwear, but I just take their jackets off, and they're so nicely designed that you can get a great sense of where things are. And the greatest thing about electronic health records, which I've seen in several, not all of them, but you can take a photo of this and upload it into their chart. So it's privacy protected. If your EHR is HIPAA compliant and no one else has access to it, and you've got a record of at least a baseline, and then periodically you can check in with them about it. So great to have, an easy tool. I also take photos of scars because I do a lot of scar work, and I want to see how that scar changes over time. If it's less observable, like not so red or angry, and more relaxed, not puckering on the skin. And then you could also put measuring tape up next to it, a little tailor's tape, something cotton or soft plastic, and show how the scar could get smaller with work over time. You can also do videos of motion testing, strength testing, those kinds of things, and that makes it also very fast. You're not having to write down results with your movement tests. Again, something to do baseline, and then just get another quick clip of it periodically over time, not something you would ever do every single session. But these outcome measures are absolutely critical if you're working with insurance, especially car insurance or something that requires pre-authorization, and helpful for keeping clients coming back on a cash basis, because people just really see the results and get very excited about it. There's also quantitative measures that you can discuss with their movement. What's the quality? Oh, sorry, the quantitative, obviously, but the qualitative measures, what's the quality of the movement? Is it sort of ratchety as they go through the range of motion? Is there a firm end feel at the end? Is it a nice, soft, squishy end feel in their range of motion? Are they limping when they walk? So really pay attention to quality and not just quantity of measures, and you can show progress using those as well. It definitely keeps them coming back if you can show them graphed progress over time. This is something that my system just automatically does. The more data you enter into the system, you can see there's lots of ups and downs with people, but basically the pain started out at an 8, a 7 or 8, and got down to no pain, or at the worst, a 4 out of 10 pain nearing the end of care. So, and about just under a year later with this car accident client, sometimes you'll get a blip in there where you forgot to put skip if somebody didn't do their post-session feedback. But for the most part, their activity improved greatly. And then clearly something happened at the very end. They probably went back to mountain climbing, I think, with this client. So it's great if you can find a system that graphs progress over time. Your client, when they log into their system, they'll see this first thing. It's right on their homepage, and they get to see how they're improving over time. And it might be motivating for them to participate more with the self-care in between. So we want clients to keep coming back. Functional goals are another way to do that. I know in my books, I've talked a lot about specific, measurable, attainable, relevant, and time-bound goal setting. These should always be tied to some activity of daily living that they're really motivated to get back to. I've had clients where after several months of coming in, they start telling me what their next goal is going to be. They don't even wait for me to ask. They want to get back to doing walking to work and back every day of the week, and not just, once a week, one direction kind of thing. So those kinds of activities advance over time. What's also nice about electronic health records is, as you're giving homework assignments, you can upload documents. You might have a handout that you want to share. You might have videos that you want to share a link with. Having something that's in their chart that they have access to on a regular basis just really helps them be responsible about their goals, to remember what their homework was, to not come back and say, oh, I forgot what it was, because it's right there in their chart, and they can take a look or click a link and get right to a helpful video, a demonstration of a self-care technique or an exercise, or I do a lot of lymphatic drainage and dry brushing homework. So really helpful things. So I really, again, just want to say thank you to Biotone. I know I went through that rather quickly and got a little tongue-tied on the first HIPAA slide, but I really enjoyed being able to share a bulk of information with you in a short amount of time. And I want to be able to take questions from you. So I'm going to stop sharing my screen and we'll get back to Donnell.
Well, I'm here. Just a second. Let me start the video.
Okay.
Hi
Hi.
again. Well, very fascinating. And, I'm not a massage therapist, so I go through this from the client side. And I don't think any of my my
Really?
people have electronic health records. My eye doctor, but it's interesting. I mean, if I
Yeah.
had something access to this and there was like homework,
Right.
scary word, or like exercises to do, let's say to help my lower back.
Yeah.
Yes, that engages the client more.
Mm-hmm.
And you feel a responsibility and a partnership in healing yourself, is how I would think about that. Yes, I'm getting a massage, but I have a part to play in my own healing as well. And I'm finding these exercises help. So it's very interesting. And I was also thinking, I went for an annual exam this past week, and you get there early because we'll have paperwork for you to fill out, and you're filling it out. Then I thought, does this, listening to you tonight, does this go into a file or does someone put it into a system?
Yeah, they'll scan it on in and put it into a
Okay.
system, because all hospitals and major clinics are required to do electronic health records. When we don't take Medicaid and Medicare, are not required to use electronic health records. But as you've seen, maybe on a national level, there's a movement afoot to get us into Medicaid and Medicare. When that happens, absolutely every massage therapist will have to start using electronic health records.
Well, I really think it's a great tool to have, and a tool for partnering with your client and keeping the client informed of their progress. I mean, the graph
Right?
was great to see as well. Um, I don't want to, get into my stories or how that
Yeah.
would be helpful, but I can see,
Yeah.
it would be nice because I've noticed a change over the last year, and to see the progress or see how it's charted would get me excited.
Mhm.
Would say, oh, it's not a fluke. This is really improving.
Right. Right. My money
So,
is well invested. And
yes,
I don't mind paying my massage therapist to see them instead of trying to do things more on my own,
right,
because my money is well spent.
right, exactly. So
Yeah.
I, I, I think this is an excellent tool for people in practice. Um, let's see, there was a comment that came in. I very much appreciate this. The work we do is with post mastectomy or other breast surgery
Mm,
clients, and we are using an aesthetics program for charting, as we could
yeah.
not find a massage program that covers what we need. Yours sounds very interesting.
Yes. And I do have several intake forms. I try and customize intake forms and make them available, because the intake forms that are up there are not customizable. It requires a higher level of a system and not a lot do it. So there is a cancer intake that I worked with other cancer educators around the country to create.
Very interesting. Susan has commented, with electronic health records and using OpenNotes law, how far back should be presented if someone asks to see it?
Good question. So in your state law, there should be something that identifies how many years of records you need to maintain. And if it's a current client, you need to go as far back as the client has been coming to see you. If you've got paper notes, what I have in my system is just the ability to upload documents. So you would scan in, I tell people scan in a year at a time. So they could go to that year and then page through and see the notes from that year. So as long as you've got a documents folder in there that you can upload your paper files into, which is why I say they're just going to upload the form that you filled out on a paper, Donnell, and put it into the system because they have to have it available. So why they didn't give it to you electronically to fill out, I don't understand. But yes, Susan, you can upload them into systems that way and just make it all available. If you weren't charting back then, that's another thing. You, as soon as you know you have to be charting, you just start, right? It's doing your due diligence to follow rules as soon as you know about them. So don't feel necessarily bad about the months or years that you don't have charts, but any charts you do have should be available.
Great. I do not see any other chats or comments that have come in, Diana. And what I'd like to know, do you have copies of your books there that you want to hold up and share with folks?
I have my latest edition of Hands Heal. This is the 5th edition. So in this, what's different is I really talked about electronic health records in there. And much of what's in this conversation got put into the book OpenNotes rule. We didn't know when it would go through, so we didn't put it in. So that information isn't in there, and then any other rules or regulations that might have happened in your state. Of course, it's a generic book for the whole country. So that kind of information wouldn't be in there, but otherwise it's the latest edition that's available.
Great. And again, you did an EduTalk author series for us on that book, which is on biotone.com under the EduTalk tab. Let's see, since we're seeming to be out and about and resuming normal-ish public life, are you attending AMTA National Convention, or are you out at any shows this year that if folks are out and about as well, they can stop by?
Yeah, I am going to be at the IBTREC conference. That's the Massage Therapy Foundation research conference. So it's the International Massage Research Conference that happens every 3 years, is in Washington, D.C. next week. So I'll be there.
Oh, great.
For that. That'll be fun. That's my first venture out into the world since the pandemic. So fingers crossed that I'll have my best skills available in terms of communication and networking and, being social.
You'll do great. You'll do great.
It's so different. And then, yes, I'll be at the National Convention in Ohio in August.
August in Cincinnati or Cleveland?
I think it's Cincinnati.
Okay, great.
Yep. Yeah.
Well, that will be nice. Boy, this year is flying by. Well, I want to thank you so much. This has been a very informative talk, and I feel as a client, I'll be more aware.
Yes, you should ask
With
your massage therapist to
yes.
see your notes and see what they
Actually, do you
say.
know how franchises work with charting?
I do, because I've consulted with a few of them. I did some big consulting many years ago with Massage Envy, right when they started, and helped them develop their charting system. And I did some online recorded education series with Elements. So I know that they all chart every one of their sessions.
Oh, great. That's good to know.
Yeah.
Well, I'd like to mention to everyone, again, thank you for joining us tonight, and please join us for these upcoming Edu Talks. On May 17th, in 2 weeks, we have Janet Wolf Blevins, and she'll present an introduction to acupressure. Then in June, I mean, how has half this year already flown by? But June
Right?
7th, I know, June 7th, Ruth Werner, massage and long COVID. Can they go together? So that will be an excellent topic. And June 21st, we'll have Dr. Ben Benjamin, and he'll present on the low back assessment and treatment, the most common cause of pain. So we have some great lineups. Yours was so informational tonight, and thank
Good.
you. We will be sending out an email tomorrow with a recording link so you can re-listen to Diana's talk tonight. And any handouts will be included in that email. And I'll also
Yes.
include a link to the EduTalk author series so you can listen to Diana review her Hands Heal book. So
Great.
thank you very much, everyone. Thank you, Diana. Thank you, Biotone. Be well and stay safe, everyone. Thank you.
Yes. Thanks for your time.
Okay, and you're getting many thanks here in the chats. So thank you again, Diana.
Yes, you're
Take
welcome.
care, everyone. Bye-bye.
Bye-bye.